Hi, my name is Ahmad Rojdi, and this is a 50 years old patient referred to me 2 weeks after repair of rupture globe, corneus clearal wound. He presented to me with a dropped nucleus. I started the surgery by doing an anterior vitrectomy. Then I'm aspirating the lens matter with the vacuum of the probe. It's crucial to avoid damage to the remaining capsular remnants, as there is already a loss of large part of the capsular bag below the area of the corneus clearal wound. Now I went back to remove the dropped nucleus. I started by doing a core vitrectomy. Then I'm removing the dropped nucleus with a high vacuum and a low cutting rate. And you can see how efficiently the 23 gauge probe can remove this relatively dense nucleus using a high vacuum and a lower cutting rate. Now I'm injecting triamcinolone to help me in posterior vitreous detachment. Now I'm aspirating at the edge of the optic disc using a high vacuum. I tried multiple times, but the hyaloid was very adherent to the optic disc. So I switched to the macular area. And again I'm aspirating with a high vacuum, and I'm trying at multiple locations to detach the hyaloid, but it was very adherent to the retina. Again I'm trying very carefully. And finally I was able to detach the hyaloid. Now I'm trimming the detached hyaloid. Then I'm activating the vacuum again to detach it over the nasal part of the retina. Then I'm doing peripheral vitrectomy. Now I am indenting to make sure that there is no peripheral retinal break. Now I am loading a 3-piece IOL. I injected the IOL over the iris. Note that there is an area of loss of the capsular bag below the area of the corneus clearal wound. So I'm planning to fixate one haptic using the Yamane technique in the area where there is no capsular remnants, and I'm planning to insert the other haptic in the sulcus at the site of the location of the capsular remnants. So after creating the flange, I am inserting this haptic in the sulcus in the location where there is a capsular remnants. There was an area of large iris defect below the corneus clearal wound, so I decided to repair this iris defect with a single pass 4-through pupilloplasty. Now I'm doing an IOL reposition to make it perfectly centered. And thank you for watching.